The Health Collaborative currently convenes about 300 plus experts, sometimes daily, in our efforts to mitigate the spread of COVID-19 in our community. These leaders include public health officials, skilled nursing directors, emergency responders, clinicians, and many others committed to keeping our community safe and healthy. But we need your help. Our region is in critical condition. And unless we make a concerted effort to turn things around, the prognosis is not good. COVID-19 is spreading faster in Ohio than in the US as a whole, while the number of people infected in our region is the highest it's ever been. Currently, Ohio sees roughly 42 new cases of COVID per day per 100,000 population. In contrast, New York sees 17 per day per 100,000. Ohioans are nearly 2.5 times as likely to get COVID-19 as New Yorkers. Hospitalizations have reached dire levels. Beds and equipment needed to treat patients are running out, and staffing has become a significant challenge in our response to the pandemic. I'm joined today by leaders from local health systems with yet another urgent message. We're here to tell you that the time to act is now. The time to wear a mask is now. The time to skip large social gatherings is now. The time to make smart decisions is now. None of us are exempt from sharing the economic and personal burden of COVID-19. We're in this together, all of us, and we need to act immediately. So I'm going to kick it over to Tiffany Mattingly here, who's going to be our moderator. And I just want to thank you for joining, and thanks to the panelists for all your incredible work and partnership.
Great. Good morning. Thank you, Craig. I'm Tiffany Mattingly, Senior Director of Clinical Initiatives and Quality Improvement for the Health Collaborative, and a registered nurse by training. I will be introducing each speaker today. As Craig mentioned, staffing has become our primary concern in the region. As a nurse, I know firsthand the diminished mental health and fatigue associated with staffing shortages. Know that with every safety precaution you take, like wearing a mask, protects your neighbors, your community, and our healthcare workforce. I'd like to introduce our first speaker, Dr. Steve Davis, Chief Operating Officer of Cincinnati Children's, to give us a closer look at the numbers and what they mean. Dr. Davis, welcome.
Thank you, Tiffany. And I just want to start out by recognizing the tremendous work that the Health Collaborative has done in keeping us organized across the system. I think we have unbelievable collaboration across all of our hospitals that is in many ways unique around the country. I'm going to attempt to share my screen and show you where we are with the data. And can one of you let me know if you can see the screen yet? Okay, good. So what I'm going to start out with a global view and then very quickly get to a local view. I just wanted to show you this because the cases are really increasing dramatically around the world. In particular, the US cases are increasing almost a straight line up. This graph is 1 day old, and yesterday there were 163,000, which would be off the chart on this. So now we'll go to just where are we in the Hamilton County and 14 County area. As many of you remember, we've been tracking the R value since the beginning. Briefly, any R value over 1 means the pandemic is increasing, and the R is at 1.26 in our region. And if you look at the bottom panel, you'll see the number of cases is going up dramatically. Sorry, it's taking a little bit to advance the slides. This is just in the 4 largest counties in our region. Craig Bramer mentioned we were at 42 cases per 100,000 population. We are actually now at 48 cases per 100,000 in Hamilton County, 49 in Butler, and 49 in Claremont, and 47 in Warren County. It's not just cases that matter, though. As Tiffany said, it's really the burden it places on our hospitals. What you're looking at here is the number of patients that are in our Region 6 hospitals. And you can see that it has gone up dramatically. On October 1, we had about 100 patients in our hospitals who had COVID. As of this morning, we have 474. Now, our ICUs are the most precious resources for our patients. That's where the sickest patients need to be cared for, and they consume the most resources. Back in early October, we had 27 patients in our ICUs. As of this morning, we have 107. This puts tremendous burden on the hospitals, on the providers, and on our resources. Just want to show you that it is not just about patients in the hospital. This may be a little bit hard to see, but this is the deaths per day in the 14-county region. And you can see that we have had days where there are as many as 25 patients who died just in our region. And we've been averaging about 20 a week since the beginning. As our cases go up and more of our most at-risk citizens get COVID over the coming weeks, that number will go up. And Dr. Alessandrini pointed out the last time that was like a busload of people dying each week. Well, let me put the US number in perspective. There were 1,800 deaths yesterday. That is the same as 6 747s crashing and everyone on them dying. By mid-December, we will likely have more deaths from COVID than from World War II combat deaths. Last thing I want to show you is a model that one of our brilliant scientists at Children's put together for us, Dr. Hartley. This is a model based on our own data on where we can expect to be. Back in late October, Dr. Hartley predicted that by today we would have 107 patients in our ICUs, and that's exactly where we are. On the right-hand side of this is his predictions for the coming days. And you can see that by Thanksgiving, we may have as many as 164 patients in our ICU and 683 in our hospitals. And that would put a tremendous burden on the systems. We would have serious trouble taking care of the people in our region who both have COVID and those who have other medical problems. This is not just affecting people with COVID now. People who have other medical problems, their care will be impacted if we don't act aggressively. And that is all I have to share. I will turn it back over to Tiffany, and I will unshare on the screen.
Thank you, Dr. Davis. You always do a great job representing the data for our region. I'd like to turn it over to Dr. John Kennedy, who is representing the Christ Hospital Health Network this morning. Welcome, Dr. Kennedy.
Thank you, Tiffany. So I want to talk more about the art and science of behavior change. What we're asking people to do is to change their behavior by mask wearing, social distancing, and ultimately getting a vaccine. But what the science tells us is that one single message will not work. And probably the foundational study was done at Yale called the National Risk and Culture Study. And the concept coming out of it is called cultural cognition. That is, one's values and beliefs affect how you receive information and whether or not you believe it. And this has been proven with death penalty, minimum wage, global warming, gun control, all kinds of policy decisions. And we can add to that now mask wearing, social distancing, and vaccine adoption. Same principle applies. So what is that? What is cultural cognition? I think we have discovered it's overly simplistic to talk about liberal versus conservative, Republican versus Democrat. There's actually multiple layers of assessing things. The two that come to the forefront are individualism versus community orientation. The second is a hierarchical versus an egalitarian orientation. You can put those together into a 2x2 grid to basically have 4 different market segments. Now, some of those segments already are adopting masks and social distancing, others are not. It's different based on the grid. So what cultural cognition tells us is that we reverse engineer our perception of risk based on the values that we take into it. So whether or not the behavior change is consistent with our values or not, it's not about the risk. We think about the solution, whether or not we agree with it based on our values, and then we determine from that whether or not there's risk. So if your values aren't consistent with the message, you're going to tune out the risk. So for an example, someone who values individualism is going to perceive a mandate of masks based on societal good rather than individualism is against their values, and they're going to reject the message. I'm going to propose two solutions, and that is that it comes right out of the Yale study. Number one, we need to frame the request for behavior change to fit the value system of each of those four grids. If you just have one message, it's going to get tuned out. So what works for one is not going to work for another. As an example, individualism. Rather than saying, let's do this for society or do it for the hospitals, we want you to do it for your family, which brings it closer to home to the individual. The second thing that comes out of the Yale study is that those messages are best received from a trusted member of that segment, not from someone from a different segment. And I think, you've probably seen on TV, Jim Tressel and Urban Meyer talking about Ohioans ought to wear masks. That's a good start. But again, we need to segment for Cincinnati. Just because they're Ohio State guys doesn't mean it's going to work for Cincinnati. So my proposal is that we have the Health Collaborative, who already has a consultant, a media consultant, serve as a convener with some, really national consultants in branding and marketing here, who I hope might donate their time to develop those four segments in those four markets, teaming up with media to deliver those and identifying trusted members of each of those four segments. Some are going to need more work than others to deliver the message that we need behavioral change that's consistent with their values. I'll stop there. Thanks.
Great. Thank you, Dr. Kennedy. Very, very interesting. I'd like to turn it over to Dr. David O, who is representing Hoxworth Blood Center today. Welcome, Dr. O.
Thank you very much. I'd like to talk a little bit about convalescent plasma. It's one of the few tools we have in our armament for patients who are actively infected with COVID-19. We've been distributing convalescent plasma from Hoxworth Blood Center since April of this year, so we were able to provide it fairly early on. This convalescent plasma is actually plasma collected from patients who have recovered from COVID-19 infection. So they've developed antibodies that we're hoping to collect in their plasma and then administer to people who are actively infected with COVID-19 and hopefully reduce the severity of their course. This treatment did receive EUA, or emergency use authorization, from the government in late August of this year, which made it much easier for people to order. And they got this EUA approval based on the fact that it was proven to be safe in thousands of people who were transfused, as well as having a high potential for effectiveness in treating COVID-19. People who have recovered from COVID-19 infection are encouraged to go to hoxworth.org and answer a very short survey there to see if they qualify to donate convalescent plasma, and perhaps turn lemons into lemonade by being able to help people who are actively infected with COVID-19 by donating their plasma. We have seen a dramatic spike in usage over the past 2 weeks, which reflects the incidents in the community. I have a couple slides I'd like to share here real quick, showing this usage here. It's a full screen here. So you can see here, these are all of the units of convalescent plasma that we have distributed from Hoxworth since April of this year. And the spike here over the past 2 weeks is very dramatic. We've had 2 days where we've distributed over 60 units per day. And over the past week, we've been averaging about 50 units per day being distributed. This compares to a baseline of about 8 units per day in September. So over a 6-fold increase in the orders for convalescent plasma. And you can see here the last week exploded. So there is a great need. We would encourage people to come out and do that. But even as we're trying to collect and distribute more convalescent plasma, we also have the need for red cells and platelets. transfusion of blood products is the #1 procedure performed in hospitals, and our rate of transfusions has been at where we were baseline before the COVID-19 pandemic. So people are still getting treatment, and they still need blood products for all the other things that patients are in hospitals for. And so we are at the same time actively supporting blood donation for traditional blood products as well. We believe that it is safe for donors to come out. In previous restrictions on travel, there have always been exceptions for blood donors to come and donate. We wear masks, and we require all people who come to our donation facilities to wear masks as they go through the process. And we need people to continue coming out to support patients not only suffering from COVID-19, but other illnesses as well. So again, you can go to hoxworth.org and find information about donation as well. I think that's all I wanted to say. Thank you for the opportunity to share this messaging.
Great. Thank you, Dr. O, and for all of your efforts in this area. We really appreciate it. Next up is Dr. Stephen Fagans, representing Mercy Health Cincinnati.
So Dr. Fagans, I was just informed, is still seeing patients. So if he hops on, I'll let everybody know.
Great. So we will move on then to Dr. Helen Koselka, representing TriHealth. Welcome, Dr. Koselka.
Hi, everybody, and thanks for being here today to get our message out to the community. I'm a practicing physician, and as a physician, I find myself in a situation I just never imagined. Usually people come to me for help, but I'm here on behalf of all healthcare workers asking for the public's assistance. Please help us. Help all the healthcare workers who are caring for this growing number of COVID patients by slowing the spread. Healthcare workers are tired. We have been doing this for 9 months. And mind you, our docs and nurses are extraordinarily capable. All the healthcare professionals are, but we're tired. We're tired of seeing people who are struggling to breathe. We're tired of seeing the fear on the faces. We're tired of seeing people who were passing away, who were in their normal state of health just a few days prior. And now we're seeing it more and more every day. We share the message with the governor and all the health systems that the steps are pretty basic. We need to all wear a mask, stay 6 feet or more away from people who are not in our household, limit our social gatherings, and wash our hands. I participated in this press conference just a few weeks ago, and at that time we were sounding the alarm as we saw this third wave coming. And now we're here trying to blast a siren. We need the community support. We know the public's sick of hearing about COVID. They're done with the mask and the disruptions of the pandemic, but ignoring it, not making it go away. In fact, with this degree of spread, most everyone's going to know someone who is either has the disease, hospitalized, or worse in the very near future. Cincinnatians are truly fortunate to live in a community with the hospitals and the health systems that are very proactive to manage this, reliably safe and clean, and open for business right now. And TriHealth and all of the hospital systems have been preparing for this for months, hoping it wouldn't come, but sadly it seems to be coming towards us. Currently, all of us have higher patient volumes because of COVID, but we continue to care for all of our patients. We have enough PPE, we have contingency plans for additional beds, and we've got flexible staffing. And we made all these plans so that we could continue to care for heart attacks and strokes and deliver all the babies and do the surgical procedures and all the elective things that the public really relies on us to do. And we continue to intend to provide all those cares, all that care that everybody wants. But if this trend doesn't stop or break, we are going to reach a point that we as a community and we as a health system are not going to be able to provide our normal services. Our EDs will be overcrowded, and a lack of staff or beds in both our inpatient units and our critical ICUs will be a new reality for us. And with that reality comes the risk of delayed care. And sadly, as we learned from the spring, some unfortunate outcomes, and we don't want that to happen again. So TriHealth and all the health systems in this community are doing everything in their power to stay open and care for everybody, continue to do elective procedures, but we need everyone else to do their part as well. We need everyone to take personal responsibility, wear a mask, wash your hands, maintain social distancing. which are the keys to slowing the spread of the disease. And I'm going to add, please rethink your Thanksgiving plans. I know I am. I have 4 kids, and we've had big family celebrations every year at Thanksgiving. And this year we've got plan A. If the weather's nice, we'll have 10. Plan B, if the weather's poor, it's just the 6 of us inside. It's disappointing, but it's only 1 year. And, I, like so many other healthcare workers who are making similar plans for their Thanksgivings, know it's the right thing to do to protect ourselves, protect our families, protect our loved ones, but really be available also to help everyone else in the community. So I thank you. I really think this is an important message to get out to the community. Thanks.
Thank you so much, Dr. Koselka. The eye-opening view into our hospitals is really important. It's something the public doesn't see every day, and I appreciate you sharing that with us. Up next is Dr. Alessandrini from UC Health.
Thanks, Tiffany. Thanks, everybody. There's not a lot else to say. So what I'm going to do is just reinforce a few things and make a few statements. Again, as Dr. Koselka said, 3 weeks ago we were together. We've lost track of time with COVID. I think it was 3 weeks ago. And we can't sound the siren louder than we can right now. And Dr. Davis showed you numbers that really should take our breaths away, that we have quadrupled the number of people in hospitals and intensive care units with COVID. The lines are going straight up. There really is, it can't get worse. It really can't. And so we hear nationally, and I have personally heard from people working at UC Health, we're so tired. Where's the magic wand? Can't we just have a magic wand to make this go away? But there is not a magic wand. There is magic, right? We can make magic in our community if every single one of us commits to those things that Dr. Koselka talked about. Whether you're an individualist person like Dr. Kennedy talked about, or a community good person, by virtue of wearing your mask, physically distancing, limiting the people that you come in contact with, washing your hands, that's when the magic happens, when every single one of us does it, every single day and every single time. And if we don't have that magic that we create, we are going to be in a lot of trouble, and we're already headed there. I'm going to talk first about visitation to hospitals. Many of us have had family members in the hospital. Could you imagine having a loved one in the hospital and not be with them? If we don't stop the spread, that's what's going to happen. Your loved one is going to be alone, could possibly die alone without you there with them, holding their hands. I don't know what else to say. That impact is real. We are here for you every single day. UCMC is the level 1 trauma center of our region. If you get in a car accident, whatever, we are here to take care of you. But we have to have the staff to be there for you. We have to have the space to be there for you. And every time we add 20, 50, 100 patients with COVID, it's eliminating our ability to provide that timely care that we want to give you within seconds of walking in the door. So it's COVID, it's non-COVID, and it's your healthcare workers. We want to be here for you. And we're just asking you as the community to make the magic occur. Wherever you are, do those simple things. So I'll end it there, turn it back to Tiffany so we can continue our conference.
Thank you very much, Dr. Alessandrini. With that, I'm going to turn it over to Commissioner Denise Driehaus, representing Hamilton County. Welcome, Commissioner. I think you may be on mute.
Thank you. Sorry. So look, there's not a lot to add, but to the point where we need to make sure people are understanding our message and the dire situation we're in. And I talked to the Commissioner of Health for Hamilton County this morning, and we continue to see an unseen rate of increase in our community, as you have all noted. But I have heard in the past, we've got increased positivity rates because we're doing more testing, and we are doing more testing. But as you all know, that doesn't attribute to all the positive numbers. And people have said, well, it's only when we see an increase in hospitalization and death that we're going to take this seriously and start to respond and wear the mask and do what we know people need to do. That you are sounding the alarm today is, I think, what people need to hear. Because I think some folks have been kind of waiting, wondering, when is the tipping point? When is the moment when they are going to start to wear that mask and distance and stay home when they can? Now is that time. You have made it abundantly clear that this strain is not only on the community and on our family members, it is on the hospitals and our healthcare professionals who we should be incredibly grateful to for being in this marathon for 9 months, doing your job day after day. You're the ones that are most fatigued, and we need to respect that and respond to your message today that says this is a dire situation. Positivity rates are up, also hospitalization rates are up, and soon death rates are going to be up. They follow one to the next to the next. So I just want to thank you for hosting this, for sounding the alarm. I think you are the right messengers at this time. People rely on healthcare professionals in all other things, right? All other diagnoses, we rely on the experts to tell us how to behave and what to do. You're doing that today, and I'm hopeful that the community will hear this loud and clear and respond to your message. So thank you for all that you're doing.
Thank you for your words, Commissioner. I'm going to turn it over to Mayor Cranley, representing the city of Cincinnati. Welcome,
Thanks.
Mayor.
Thank you. Thanks for putting together this amazing panel to talk about the seriousness that we face. Look, let me start with some good news. We have a vaccine, Pfizer. It's coming. There'll be others. And 6-8 months from now, we'll be back hopefully to semi-normal. We're rushing to create as many outdoor spaces as possible for the spring. So there is a light at the end of the tunnel. This is not the way we're supposed to live. This is not fun. This is terrible. I hate it. I hate that my 11-year-old son is missing out on a lot of rites of passage that he would otherwise get, and so many other children and families across this community. We're almost there. But I'm reminded of the tens of thousands of people that were killed in World War II after D-Day. After D-Day, it was clear we were going to win. But many tens of thousands of people died before the end of the war. And that's where we are right now. The end is clear. We're going to win. We're going to have a vaccine. But a lot of people could die between now and then. And we just have to get through this really dark winter of our discontent. And it does mean making sacrifices that I don't want to make. And I know other people don't want to make. And to that end, we are announcing today a number of changes here at City Hall. We will be going back like we did in March and April to get through the holidays, where we know that people will, despite warnings, bring people in from outside their bubble into their environment, which puts a lot of other people at risk. We will be once again closing City Hall to the public for several weeks while we install air purifiers and additional separators for council meetings and other meetings between citizens and the administration. In addition, we want to make sure we cycle through to protect our workers from 14 days of Thanksgiving, 14 days of Christmas. And so we're going to try to lead by example. I'm going to start working from home a couple of days a week. And we are going to ask anyone and everyone who can work from home to do so. Not everybody can, and that's okay too. And we need people to continue to work with masks and safely, and to keep the economy afloat. But the reality is that this is the last couple miles, and we've got to get to this vaccine, and we can still save a lot of lives. So we will be doing what we can, leading by example. And we encourage any and all businesses out there listening, if you can get your employees to work from home, please do so. We're sorry for any inconvenience at City Hall over the next several months as we update the technology, the air purifiers, the separators. But also, we just want to make sure that our employees are protected from Thanksgiving gatherings of other people who may come into the building. So now is the last couple miles, and let's stay all this in together. Thank you.
Thank you, Mayor Cranley, for your words of encouragement there. At this time, I'm going to turn it over to Krista Hyson, who will be moderating our media questions today.
Good morning, everyone. Just as a reminder, please utilize the Q&A function within chat. I will make sure that I try to hit all the questions that have been emailed, texted, and direct message to me. So first question from Channel 5, how close are we to postponing elective procedures? And lastly, are healthcare systems struggling to get resources needed like PPE or equipment? Are we prepared to ensure doctors and nurses are protected?
Yeah, I can start with that one. That in Cleveland, the Cleveland Clinic just announced a 2-day suspension of elective procedures. So it's happening in other parts of the state. And I know that every hospital here is talking about it and preparing for it. Nothing's happened yet, but we're on the brink.
I'll just add to Dr. Kennedy. As most of you know, we meet every day as the different regional health system leaders to have these conversations. Our PPE is strong, and the health and safety of our workers is number one. So we feel confident that our healthcare workers are safe and protected for what we can do as the healthcare systems in terms of assuring that they have the equipment that they need to function. One of the risks that we're hearing about, and it's important for our region to understand, is that some patients are coming into our facilities refusing to wear masks, and that is not acceptable. When you come into a healthcare system, you must wear a mask unless there's a medical indication not to, in which case we'll work with you on that. Or you'll just have to video in with your family members, right? So again, it goes back to needing our communities to force multiply how we are keeping our people safe for them to continue to care for our community. And again, if we start to slow down elective cases because we talk about it, we prioritize, we vet the cases every day, the people that are going to suffer are our community members. You know, if you've had that awful hip pain for years and you finally have your hip replacement scheduled and you're looking forward to, you know, getting through that rehabilitation and being pain-free, that's who it's going to impact. It's going to impact the community. So we don't want to do that. But again, our number one priority is keeping our healthcare workers safe so that they can take care of you.
Krista, this is Steve Davis. I'll just follow on that and say there's very little that we do in the hospitals that's truly elective. It may not need to be done today, but it needs, much of what we do needs to be done in the next week or the next 2 weeks. As Dr. Alessandrini said, you can put off a knee replacement for a little while when it's someone else. But when it's your mom who's been suffering from knee pain and has surgery scheduled and can't sleep at night and gets canceled, that's a real impact. So there's very little that we do in our hospitals that's truly elective.
So next question is for Mayor Cranley. At what point would the city of Cincinnati have to implement a curfew or citywide lockdown to prevent the spread of COVID-19? If not, then what further measures can be taken?
Well, we will always keep all options open. But it's my personal preference to keep the economy going and to lead by example. And that's why we're going to shift to remote work. We're going to shut down City Hall. We're going to cancel meetings for several weeks in order to get air purifiers and separators in for this long winter, because January and February is going to be colder and worse than what is now, which is we've had some nice weather today and recently. So, you know, I predict that things will get worse before they get better. And, you know, frankly, it's time for personal responsibility. You know, save yourself. As Professor Kennedy said, you know, this is about you and your family. And so don't go to a mass event. Don't go to a party. Don't have a party. Wear a mask. Be smart. And I think that that's really the main issue at this point in time. And I think it's personally for me, it's critical that essential services continue, like schooling and the economy. And so I don't want to see those things sacrificed. I just want to see them done safely and with masks, because there are all kinds of other unintended consequences that result when those things shut down, whether it's depression, anxiety, lack of education, lack of meals for many kids who can't get food unless they go to school, things of that nature.
Next question I received from multiple sources, so I'll kind of combine them. So at what point do we have to identify backup plans for when hospitals are full and there's not enough staff? How close are we to these issues? And can you talk about specifics within your hospitals of what you're experiencing with staffage shortages?
So I guess I'll start and then turn it over to my colleagues. I would say we're there now. There really is not any longer to wait. One of the challenges that we're facing is that people are not accustomed to exponential growth. And we're used to incremental growth, a little more each day. What we're experiencing is explosive growth. So there really isn't any more time to wait. And if you think about it, any actions that we take today will take a week, 10 days to have a real impact, because people are already getting exposed and infected today, tomorrow, and the next day. So for the most part, the die is cast for the next week to 2 weeks. So really the time is to act now. And I'll turn it over to some of my other colleagues to talk about what they're feeling at their hospitals.
I can relay a story from Montana, a small rural hospital, which is entirely full. ED is full. They've actually locked the doors to their ED, and they are screening people in the parking lot to see if they will even let them into the hospital. That's what happens when you're full. At every hospital in Cincinnati, we cooperate, we collaborate, we understand who's got capacity. We do that through the Health Collaborative. And when a hospital is entirely full, it goes on diversion and we shunt to other places. Well, when everyone fills up, there is no more diversion. It's just you don't get in.
I'll just add that, you know, in our daily conversations, we see the major hospitals in our, you know, more urban core are above 90% filled every day now. So as Dr. Davis said, we're there. We are planning every single day. Our surge plans are active, and we're engaged in all of those. You know, our risk now, like we said, it's not PPE, it's our people. And one of the things that's tricky for us that we're following are the number of healthcare workers in our region that have COVID. It's a lot, and it's going up because that exponential growth is the same as the rest of the exponential growth within the community. And so that's going to be our biggest limiter. And so again, we're tracking it every day about keeping our healthcare workers safe. Last thing I'll say, because Dr. Koselka should definitely weigh in as well, is there are some communities that have asymptomatic COVID positive healthcare workers caring for COVID positive patients. We haven't gotten there yet, but we have everything on our list and in our cookbook and our armamentarium to keep going. But I don't think the average person who has COVID really wants to be working. So let's prevent the spread in lieu of going down that path.
And I'll add the same things that everyone else has said. We continue to plan every day. We've got plan A, stage 1 plan, stage 2, stage 3. And we're at the point where we are still able to provide all of our services, and we want to stay there. But we can flex to a certain extent, and that's the next stage. And then after that, we have to take more drastic measures, and we just don't want to get there.
So the next question is for Dr. Steve Davis. What is the percentage of med-surg and ICU beds that COVID-19 patients are using?
So it's different at each hospital. The numbers are going up, and it actually is not, it doesn't really matter anymore, because earlier on when we had a shutdown, our hospitals dropped to about 60% of their normal census. They're now all in the 95% range. So whether the number of patients in the hospital from COVID is 10%, 20%, 30%, or 50% really doesn't matter. It means that we don't have enough capacity to handle the future COVID patients and all of the things that happen to our people every day anyway. And the one thing that we haven't mentioned yet is that it's flu season. And so we will start seeing more patients with flu. And one of the things that was shared on the hospital call this morning is that there are patients who have gotten both the flu and COVID, and those are about the sickest patients that you could imagine. Those patients have a tremendously high risk of dying. The important thing to know, though, is all the measures we're talking about for COVID will help reduce the burden of the flu as well.
And this is a question for Dr. O. What is the latest data on the effectiveness of convalescent plasma as a treatment? You're muted.
Thank you. The fact that convalescent plasma received EUA authorization in late August was significant in terms of thinking that it was possibly effective. I think that a lot of those studies probably will not get performed now. We are participating in those studies. We had a local study with Christ Hospital as well as with TriHealth, and UCMC has a number of studies that we've been participating with convalescent plasma. But I think enrollment at this point is going to be lower, and it's going to be hard to get that definitive answer. I think that the long-term solution really is vaccination, but I think convalescent plasma will continue to play the role that it's playing until that becomes more widely available and cases go down.
The next question is for Commissioner Driehaus. What can be done about the Thanksgiving Eve bar hopping tradition?
I think this should be a question for Mayor Cranley.
I was just going to say, they asked you on purpose.
I'm a lot older than Cranley is, so I'm, although I guess I should be flattered. Look, that's, a lot of this is going to be tempered perhaps by what happens here in the next couple of weeks. So obviously we don't want people gathering in large numbers in bars, especially unmasked. But I do wonder if things are going to shift here a little bit. So the recommendation is what it always is, wear a mask, don't put yourself in an unsafe situation, / don't go bar hopping the night before Thanksgiving.
Great, thank you. And this is for anybody that would like to answer it. What are the panelists' views on children going to school in person? Should schools go to a total virtual environment?
I guess I'll start as the person at Children's Hospital. I would say that it is really important for kids to be in school whenever possible. So far, our schools have done a really good job of keeping kids safe. And we're fortunate that kids, for the most part, have not gotten seriously ill from COVID. There have been a few, but not nearly like adults. The problem is that if more kids get infected, they are often asymptomatic and they do spread it to their parents and their grandparents. And those are the people who are most vulnerable. But we know there's significant harms to kids when they are not in school. And we hope to be able to, that people will make the necessary sacrifices so that kids can stay in school.
Yeah, I agree with that. And I say that with my own son in school, 5 days a week at a Catholic school, and they've taken extraordinary measures to keep masks on the kids, to prevent close contact with the teachers. So I'm not saying it's easy. It's not. It's very difficult. And I can't say it's not a one size fits all. We have kids who are participating remotely by choice at our son's school, and they're very aggressive about quarantining people if they've had any exposure to someone who's COVID positive. So there are a lot of protocols that have to be adopted to do it right. But I agree that my son is much healthier emotionally and intellectually by having in-person school 5 days a week. And I hope that we can try to achieve that for our other students throughout the coming weeks and months.
You know, and I'll just add to that, the other thing about kids not being in school or being in school virtually is that impacts the kids who are already most disadvantaged more than others. So for those of us on the call, you know, internet access at our house and computers in our house, it's not a problem at all. We have several. For kids who are already impoverished, that puts more of a burden on them. And there's clear evidence that kids are safer when they are in school and have structure and are wearing masks than when they are out with their friends. And maybe younger kids would stay home. But if you're talking about 12, 13, 14, 15-year-olds, when their parents are at work, it's much less likely that they're going to wear masks when they're with their friends than they will when they're sitting in their math class.
Thank you. And we do have to wrap up at 11. Thank you, everybody, for joining. So I will ask this question as the last question. I received this anonymously. So it says, in the beginning of the pandemic, there was signs, there was honking, there was so masks for Cincy, and a lot of positive movement for our healthcare workforce. What can we do as the public to raise the morale of our healthcare workforce?
Hey, Chris, thanks for ending on this one. I'll be quick. Yeah, it's absolutely the case that early on we were all rooting for our healthcare workers. And just to be perfectly frank, I learned last night that an off-duty law enforcement person that was working security at one of our local emergency rooms wore a mask that said hoax across the front of it. And so incredibly insulting that it just hit me in the gut, because these people, you're seeing 5 doctors here on this Zoom, but there's thousands of nurses and others, of course, across our community who are putting their own lives and families at risk day after day, working ridiculous hours. And I hope that this Thanksgiving, if you have a friend or family member that's in the health sector, that you give thanks to them and show them your respect.
Hey, Craig, I'll just add to that when you're thinking about making sacrifices for this Thanksgiving, let's do it so that the next time we have Thanksgiving, no one's missing.
Amen.
Any final comments?
Yeah, I think the answer to the question is heed the call from the healthcare professionals, show the respect to the healthcare professionals that are on the front line every day, and do what they're asking us to do. Wear a mask, make smart decisions about the holidays, and stay home when we can. I mean, I think that ultimately is the best way to pay homage to those that put their lives on the line every day.
Well said. All right, folks, thank you so much for making the time. We have a good group here. Krista, do you have any parting words before we go?
No, that's it. Just to note, I will upload this presentation to YouTube because I know some of our media partners couldn't make it. So I will have that link live in a couple hours.
Perfect. Thanks, everyone. Be safe.